typically makes it not. Make sense? Now, here's what you got to understand. This is where drugs make a mistake. So God uses the same cofactor for dopamine and serotonin. Tyrosine to dopa to dopamine, and 5-HTP to serotonin. Did you think God ever intended for dopamine and serotonin to be in opposite places? If he's using the same cofactor. Do you understand? But we have drugs called SSRIs that make our serotonin high but leave our dopamine low. And then we have antipsychotics which make our dopamine high and our serotonin low. Do you think that turns out well? Why would our body use the same vitamin? Because those always have to be the same. So if a patient has a low serotonin, the answer is not an SSRI. The answer is methylfolate. Because tetrahydrobiopterin breaks down to dihydrobiopterin, and 5-methyltetrahydrofolate converts dihydrobiopterin back to tetrahydrobiopterin. So how lucky are we that we can give a vitamin and modulate our neurotransmitters? Am I totally just boring you guys?
No. So if someone's been on an SSRI for a long time,
sure,
potentially you can have long-term issues.
The answer is probably not. Here's the deal. We're also finding out that serotonin receptors and serotonin reuptake can be different in many, many people. And so we also have in our neurotransmitter panel, we have the ability to actually look at those and tell you how effective those are going to be. And a lot of people who are taking them, they're not effective at all. Do you understand? The idea is you want to think, because you can't write drugs for SSRIs anyway, okay? You want to think, how can I help this person? Because I need dopamine. Okay, I've got to get the vestibulo-ocular reflex intact, right? I got to get this person back to balancing and functioning and doing everyday life. I got to get this visual system stabilized. Okay? Now you're working on the visual system modification, but we also got to get it stabilized. Okay? Last I checked, bouncing up and down with your eyes doing that doesn't really help you too much. Okay? And the thing is, we also need methyl B12 because acetylcholine comes from phosphatidylcholine, which means methyl B12. T5P is B6. And 5-methyl tetrahydrofolate for the Krebs cycle to make acetyl-CoA so that we can make acetylcholine. Because all the extraocular muscles and many of the other reflexic type of muscular interactions are based on acetylcholine. Okay? Now, because it's CME, I have to talk about all these things separately. It's a lot easier to put them all together. Understand? I don't think anybody wants 20 bottles of supplements. Okay? I don't believe in giving more than 4 or 5 bottles. Okay? So what are we trying to do? We're trying to make good times happen, GABA and serotonin, make dopamine as high as possible, and decrease the anxiety, but we still need enough acetylcholine to make the visual system function better. Make sense? Now,